Hi, my name is Sam, and today I'm going to show you the most easiest exercise that I teach all my chronic pain patients, and that is diaphragm breathing. Now, the diaphragm is a muscle that sits below your rib cage. It's a dome-shaped muscle, and when you expand your rib cage with your breathing, that dome muscle contracts and flattens and comes down, and it allows the rib cage to expand so you can get air into your lungs. Now, unfortunately, among my chronic pain patients, over time, due to life stressors and the amount of pain that they endure in their body, they forget how to breathe, and this rib cage becomes more rigid over time. The patients fall into two different categories. They become chest breathers or belly breathers. Chest breathers are people that breathe up in their chest, and when they breathe, these muscles in the front of the neck contract, and over time this can cause a lot of neck pain, shoulder pain, and issues around the neck. So it looks like this. And then there are the belly breathers. The belly breathers are breathers that push and protrude their bellies out without effectively using their lungs. So they look like this. So if you look at me down here, these are the belly breathers. So you will just see their bellies protrude in and out. Now that said, let me show you how to do a proper diaphragm breathing. Now you can get into different positions. You can be in standing, seated, or lying on your back. You can actually be in any position because it involves breathing. But when it comes for me to teach my patients, I have them lying down on their back. I'm going to do it in a kneeling position so I can demonstrate to you what it looks like, but then I would like you to try this lying down on your back. Imagine that I'm lying on my back, okay? To do a diaphragm breathing, there are two aspects that we need to be focused on. One is the breathing aspect, the inhalation and exhalation of the portion of the breathing. So I want you to inhale through the nose 5 counts slowly, pause, and then you're going to exhale slowly and push all the air out completely out of the lungs. Now when that happens, I do not want you should not feel any tension in the neck and the upper body at all whatsoever, because remember, we want the rib cage to be the movement. We want the movement to happen at the rib cage, okay? So hands on the rib cage, look what happens to my hands. As I inhale, you will see my hands move apart and go outward, and that's my rib cage expanding and pushing into my hands. And I'm gonna pause, and as I exhale, you'll see my hands come in and down. Again. And that is a diaphragm breathing. I usually have my patients place their hands on the rib cage, which is the bony part of their sides, and that way they can feel the rib cage moving. Because a lot of people, if they don't place their hand there, they might do belly breathing or shallow breathing and they can't determine the difference. So any type of tactile sensation or visual sensation using a mirror would be ideal at this point. So you can either use your hand like this, like I have, or you could use a band. You could use a rope or a resistance band, TheraBand, anything you have at home. I personally like something a bit more stiff, like a belt of some sort, and I tie it around my lower rib cage, right on the rib cage. Now you want it to be firm but not tight. So if you look at this, I'm able to put 2 fingers in comfortably. Now, why is that? Because as I breathe in and expand my rib cage, I'm going to demonstrate with my thumb, you will feel the tension in the band increase. And as you exhale, that tension is reduced. That way, you'll also get tactile cues into the brain without having your hands in this position, because it can get tiring after a while. Now, watch what happens into the band. And as you can see, the tension in the band increases and then decreases with my inhalation and exhalation. Now with diaphragm breathing, people say, but my chest and lower belly moved. Of course, that's normal. with the diaphragm breathing, first the rib cage starts to expand, so the movement initiates from the rib cage and from the diaphragm moving down. And as the rib cage expands, obviously as the lungs expand, your chest is going to expand. And as the diaphragm pushes down, you're going to feel the lower abdomen also elevate, but they're not protruding, and you don't see these accessory muscles come on. The rib cage and the belly come on and down, but only after the rib cage has already initiated the movement. So I'm going to do this from my side with the band so you can see. Okay? All right, let me tuck my t-shirt in. Here we go. Okay, hang on. Here we go. Now, I want you to pay attention to something else. At the end of my exhale, look what happens at the end at my pelvis. At the end of my full exhale, not a shallow exhale, like a full exhale, you'll see this kind of a movement, like my pelvis moves backwards. And by backwards, I mean the top of the pelvis moves back and the front goes, and the bottom goes front. Okay, it's almost like having a ball going this way, but it's not going to be as big as this. It's going to be as small as this. Okay, so here we go again. Common mistakes I see among patients that I want you to avoid. Number one, when you exhale, make sure you exhale fully and completely, not forcefully. So there's no forcing or pushing anything. So I don't want to see this. Or I don't want to see a shallow breath. Shallow exhale like this. None of that. Your breath has to be calm and quiet and very relaxing. So no stress breathing. Mistake number two that I see. So if I was lying down, actually, I'll show you lying down. Okay, I want you to see what happens around my neck. So when I exhale, so a lot of people, when they exhale, they tense their upper body as and their abs crunch down like this. There's no crunching or doing extra tilting or moving the upper body. Everything should be relaxed. As you expand and inhale, you exhale, and the rib cage naturally comes down, and there's a tilt like this. So again, watch me. You should have no movement in the upper back. Now, for the first few breaths, especially if you haven't breathed like this in a while, you might not feel the rib cage move, but the rib cage will move. I don't want you to give up. Continue to do about 5 to 10 breaths, and you'll see and pay attention to the cues that I gave you, and you will feel your rib cage move. Remember, rib cage is made of bone and muscle, and it's the muscle that's pliable and will move. What I'm teaching you, I'm reminding your body how to breathe again. So your body already knows what to do. You just have to give it time to remember. All right, I hope this helps. Let me know if you have any comments or questions, and I'll be happy to answer them. Thank you for watching. Take care. Until next video.